It's another day, the sun is shining. Got to know what's going on around you. Wake up, it's the time to motivate your mind. Come with me, let's make this moment brighter. Wake up with the Bahamas at sunrise. Come on and wake up with the Bahamas at sunrise. Wake up with the Bahamas at sunrise. Wake up with the Bahamas at sunrise. Hey.
Top of the morning, I'm Candy Pinder. Welcome to Bahamas at Sunrise.
And I am Mark Daniels, and we are both filling in for Star and Phil. We've taken over everybody. We've taken them hostage. We've tied them up. No. They are both sleeping in this morning. I hope you both had a great weekend, and you guys have a wonderful day today, eh?
They're living up their best life. But look, you see Godfrey Burnside here. I'm having a good time. Say, Phil, say you duck us.
Yeah, he gets stuck in the right place. Good job, buddy. Good thinking.
Man, you know, I didn't get to watch the sunrise today. I normally watch it around 6:20. Do you ever watch it?
I try to. Well, most mornings, my youngest son wakes up sometime between 5:30 and 6:30. So I am usually up around that time to see the sunrise.
Yeah, that's a good thing. So tell me about Andrus, the business outlook. I know it was amazing.
Yes, it was. Andros is such a wonderful place. First of
Yeah.
all, from you step out of the plane onto the Androsian soil,
Yes.
the smell of the air, just the breeze. It's just a very invigorating feeling to be at the big yard, right? And the people of the big yard, man, they're so great. I feel the people of Andros are the greatest natural resource they have. But apart from that,
that's
you know,
true.
you got the water, you got the crab, you got the hog, you got the pine, you got everything in Andros. So I think we just move in Andros. Let's go.
I remember one time I was on a golf cart and this boar came out of the water. And so I don't know what I was thinking, but I jumped off the golf cart and I started to run.
Now you say boar. Now this ain't a swimming pig. A swimming pig
That-
is nice and pink and
that was a
fluffy.
boar.
That's a boar. Big, brown, and gray with tusk. Brown. Big, brown, and gray with tusk. Whatever it is, it's scary, right?
And y'all toured Bamsey, right?
Yes, and we went to Bamsey. Once again, another wonderful institution. Bamsey doing great things there in terms of building capacity in the country for agriculture and bringing technology into agriculture.
Okay, well, in the mid-show, I'm going to ask you a little bit more and about the highlights and everything.
Definitely.
But we have another great show for you, everyone. Open Systems Technologies is here, and they're going to talk about business continuity and the importance of electronic documentation, which is so important
What?
in this era.
What's that?
But and so many people are being forced in that direction. People who said, no, I'm going to do it this way, and I write my stuff down. We see it, right?
Yeah, throw away all the pen and pads because it's time to switch over, right? The big talk is now resilience and sustainability, and so being able to have important documentation in electronic format is one of those ways. So
Man,
we look
ain't
forward to
nothing like a
hearing
good
about
pen and paper man.
Try
With
like them
different color pens and thing, with the nice ink, with his flow good.
that. I ain't writing so long I don't forget how to write.
And Dr. Wesley Francis is back to discuss how COVID-19 affects surgical care. And BPL is going to give us details about fuel hedging.
Yes, it's like Christmas time from BPL.
BPL.
I can't wait to talk to Brother Moxie. And Alive is here to talk about the rewards program. Dr. DeLon Brennan will give us an update on the COVID-19 in the country, and we'll hear about the new same-day COVID test available at Doctors Hospital.
Mark. So let me see if you can do it. I always tell Phil we must throw it to Godfrey properly.
Okay.
Please, give the legend his due.
Well, all this and more. But first, let us prostrate ourselves in front of the weather god, Godfrey Burnside. We are going to throw it to him. Underhand softball.
Weather at Sunrise, brought to you by Bahamas First. First in insurance, today, tomorrow.
Thank you, Mark, and good morning, Bahamas. And yeah, first look at weather at sunrise. A pretty good weekend start weather-wise. High pressure downweather feature. Have some Sahara dust out there, and that's going to actually suppress most of the activity that's been happening over the weekend for the most part. But our eyes should be on the tropics also. Today, partly sunny, hot and humid, a little breezy over the central and southeastern islands, and there's a chance of a few showers, even a possible thunderstorm popping up by afternoon. High temperature reaching 92. Yeah, it'll feel like about 104. Tonight, we're looking at a few clouds, still on the warm side, and there's a chance of a few nighttime showers, spotty showers passing, your low going down to 77 degrees Fahrenheit. And there's some region highs and lows across the Caribbean, Barbados, 83 and 79. In Jamaica, 87 and 74. In Trinidad, 83 and 76. And the Turks and Caicos Islands, 91 and 78. Across North America, Atlanta, 88 and 73. In Raleigh, 94 and 74. In Miami, 92 and 79. In Dallas, Texas, 91 and 78. And Toronto, Canada, 81 and 75. High pressure continues to be the dominant feature through the most of the week. So we're looking at partly sunny skies, hot temperatures, humid conditions into both Thursday, and then I should be in a tropic because we're watching a of low pressure in the central Atlantic moving towards the west-northwest, and the track takes it somewhere in the vicinity of the Bahamas over the next 7 days. Temperature daytime will be in the low 90s, at nighttime in the upper 70s. That puts you up on your first look at weather sunrise. I'm Godfrey Burnside. Back to you, Gandhi.
Thanks, Godfrey. For over 19 years, Open Systems Technologies Bahamas has been providing innovative technology to help businesses maximize the use of enterprise content management and backup and business continuity solutions. That sounds like a lot, and that sounds very progressive. Joining us this morning to tell us more is Peter Bridgewater, the President and CEO of Open Systems Technologies. Good morning and welcome to Bahamas at Sunrise.
Good morning.
Now, when you talk about business continuity, and you talk about technology for almost 20 years, 2 decades, that means you were ahead of your time.
Well, after working 25 years in the financial sector, I thought that it was a goal that I made to be able to work with businesses and organizations to utilize innovative technology like electronic document management and business continuity to be able to be prepared for crises like hurricanes and like the pandemic that we're having.
Exactly. So you talk about business continuity. Tell us a little bit more about that.
Okay. Well, one of the primary objectives of our business was business continuity in terms of helping businesses to be prepared and to have business continuity plans. Further to that, we also looked at enterprise content management,
Right.
which enables businesses to capture information electronically, which means that their documents, their files, they're able to access them remotely. And we couldn't see a more opportune time like the pandemic, the COVID-19, that enables working remotely with your documents.
For some people, that sounds like such a tedious and arduous process, but I'm sure you make it simple. How does one get started?
Well, what we do is we visit our customers and we discuss with them how they want to automate their business processes and areas within the organization where they are experiencing what we call pain points in terms of providing a unique customer experience to their customers. And so we look at how they utilize their documents, their business processes, and we automate those to give them an advantage in terms of being able to work electronically and remotely with their documents.
I was going to ask you about the solutions you offer to facilitate working from home because so many people are doing that now. So how do you help us do that?
Well, it starts from looking at the organization and determining what their work processes are, their business processes are, and their archives in terms of paper. And we know that by capturing and storing this information electronically, you save on administrative costs, you save on offline storage or off-site storage, you save there. But one of the big benefits is more than one user now can access
Right.
that file, and they can also work remotely.
So automation, digital signatures, compliance. What are a few other things that
Well-
people need to know?
Well, what we are doing now is, especially during the pandemic and COVID-19, we have integrated digital signatures with document management and workflow automation. And what we do is we are able to send that document remotely to our business partners so that they could sign it electronically. All right, we provide three enterprise content management solutions. We are a DocuWare authorized vendor. We are also a Highland on-base authorized vendor, as well as a NewGen. And we've used this technology in a number of businesses and organizations to help them to improve productivity and efficiency in their organization.
Yeah, now you mentioned a few things. You mentioned a few names. I was going to say, break it down for me, please. Break it down a little bit.
All of those, what we've found is that for every type of business, from the mom and pop businesses,
Right.
they all can benefit from working electronically. And so we have different solutions that can cater to the small business, to the medium business, and to the enterprise. And so what we've done is looked at technology to be able to provide an end-to-end solution for our customers, from capturing the documents to cybersecurity and to business continuity, so that they can have a complete overview and protection of their documents and their business.
Do you think that people really grasp the importance? Because I think people didn't realize or expect that we would have a hurricane like Dorian. So documents got wet, things got swept away, and they didn't think ever that they would have to back it up. So how do we really help people to really realize how important it is to do this and to do it now?
Well, you raise, that's a very good question and a very good point. And one of the things that we are doing as a company is reaching out to businesses, and not just large businesses or government that currently benefits from some of the implementations that we've done, but to all users, all businesses, to be able to embrace this type of technology. We have a cloud technology where we are able to implement enterprise document management, workflow, and digital signatures for customers. And so what we are doing during this period is trying to educate businesses that if they want their businesses to survive,
Yeah.
and not to always be in a lockdown and a crisis,
Right.
is to be able to work fluently or fluidly using this type of innovative
Because
technology.
people have to stay home, but how are you going to work from home if you don't have access to the documents? And you
Exactly.
do all of this with a wonderful team, and of course, everything is done in utmost
Oh,
confidentiality.
most definitely. Like I said, we have some government implementations, and confidentiality is a must.
How can we get more information? Where can we find you? How can we get started today?
Well, our website is www.opensystems-bs.com, and our office is in Sandyport, out west, and our telephone numbers are 242-328-6736 or 242-603-6736.
I love it, Mr. Bridgewater. This was fantastic. Thank you so much for joining us at Bahamas at Sunrise, and we'll be right back after this.
Good afternoon. First response. How can I help you?
I've been in an accident on West Bay Street. Can you send someone to help?
Yes, ma'am. A first response team will be there in 15 minutes. Are you hurt?
No, I'm fine, but a bit upset.
We're glad you're not hurt. Please, try to relax. Our team will take care of everything as soon as they arrive.
First Response provides immediate on-site service and support from the scene of an accident through the claims and repair process. And it's free to all Bahamas First insured drivers in New Providence, every day for any type of accident. If you drive and want first response on your side, call 32-FIRST or visit bahamasfirst.com for the name of an authorized Bahamas First agent. First response can't prevent an accident from happening.
But it can certainly ease your mind when it happens.
Business in the Box is your solution for business from Cable Bahamas. It's an internet, voice, mobile, and advertising solution all in one place. Get reliable internet, free domestic call, and a live corporate package, and free TV ad placement, all starting with packages as low as $164 a month. You can save over $3,000 a year. Just call 601-8911. That's 601-8911. And ask for Business in a Box from Cable Bahamas Business Solutions. Terms and conditions apply.
Welcome back. COVID-19 created a high demand for medical staff and facilities. This meant elective surgeries were canceled. What is the status of surgery here in the country now? Here to talk to us about this is Dr. Wesley Francis, consultant surgical oncologist at PMH. Good morning and welcome to Bahamas at Sunrise.
Morning, Mark.
I guess welcome back, eh?
Yes, welcome back. Thank you.
Yes, Dr.
Appreciate
Francis.
you having me back.
So first of all, I like this guy because he went to UE Mona, right? So that's
Absolutely.
That's
UWI
right?
Mona,
All right.
Irvin Hall.
Almost Chancellor.
Irvin Hall.
All right.
Definitely.
So tell us, how has surgical care been impacted by the COVID-19 pandemic in the Bahamas?
So surgery and medicine in general is a service industry. Just like any other service industry that requires human interaction, has been significantly impacted by this. Because this virus requires us to be, when we come together, this is when this virus multiplies more. So surgery, just again, like any other service industry, has been affected. And so what we found early on is that globally, not just in the Bahamas, but globally, there was significant cancellations of surgery. Now, mostly benign conditions, that meaning non-cancerous condition. We saw almost 80% of those benign conditions being canceled as a result of this. All elective surgery, meaning planned surgery, were basically totally canceled. And when we looked at cancer surgery, because we know that cancer, there's a timeline, you have to intervene at a certain point in time, cancer surgery wasn't impacted that much, but we looking at, whereas benign cases like 80%, there was about 40% cancellation. So what that meant is that at least those patients, some of those patients actually had delay in their treatment. And so what we found is, especially now when we look at Bahamas, in the month of April, there was hardly any elective surgeries being done, and certainly cancer cases were being canceled, being postponed, and this totally impacted patients in general. What other things that were impacted too was screening, and that's something to note, because in order for you to have surgery, you have to first have a workup. And so during that time, there was no mammograms being done, so breast cancer screening basically came to a halt. Colon screening basically came to a halt. So all those patients were put and delayed as a result of that. So not only surgery itself, but even the feeders to find things early. So what we anticipate is what's going to happen in nowadays, now that we're starting to do all of that again, is that we're going to find things at more advanced stages than you would have before. And so that's been the impact that we've had.
So what recommendations do you have for patients requiring surgery during this time?
So two things. One, when surgery, that encounter itself, that in COVID era, that has a risk for the patient and also a risk for the hospital staff, okay? So before, we didn't have testing capabilities, and so it was always a risk. And so for that reason, that's why everything got canceled until we had more information. Nowadays, the current recommendation by all the surgical societies is that people's COVID status needs to be known. And the reason being is that early on in the pandemic in China, when they operated on patients who actually was incubating, they weren't symptomatic, because you really wouldn't operate on a symptomatic patient. But patients who were asymptomatic, who were incubating COVID, they found that the outcomes were really poor. 100% of them went on to develop pneumonia, COVID pneumonia, and there was like about 40% mortality with those patients. So it's standard requirement now that you have to have your COVID test so that the patient will know and the physician will know what the status is. Because when you take a patient and you put them on a ventilator ahead of time, this is what we believe, that trauma from the ventilator on your lungs is what makes the patient's case more severe. And then they would then develop pneumonia and go on to have a poorer outcome.
So you have to know your status, because it's better for you, it's better for the staff, and for your recovery after your surgery. So how is this current second wave likely to impact care in the short term?
Well, two things. Well, first of all, we've seen the numbers kind of go up. So again, we got to think about the capacity of the healthcare system in terms of being overwhelmed by this.
Right.
What's reassuring right now is that you've noticed that, and when you ever see the dashboard, there's a hospitalized portion. As long as you keep that number down, then we're okay. I mean, the rising numbers are still significant, it's really concerning. But if you want to keep that hospitalized number down, because then that will say how our healthcare system infrastructure is standing up to this.
Right.
So from surgical point of view, because we now know the way what the high-risk cases are like, and we now can test, because we have that infrastructure and that testing capacity, most of these cases can still go on.
Okay.
So it's just a matter of having that conversation with your physician, making sure you get your tests. And again, we have the infrastructure nowadays for that.
So we've heard the term emergency surgery versus elective surgery. And so what is the criteria that determines emergency surgery?
So emergency surgery, the simplest criteria, basically if you need to get into the operating room within an hour to save your life.
Right.
In those days, you don't have any time to do any tests.
Right.
So what we do in terms of, from a medical healthcare perspective, this is where we do the entire, what we call personal protective equipment,
Right.
PPEs.
Right.
And so we operate on those patients without any COVID testing, because you can't test within an hour.
Right.
And you need to save that person's life or limb.
Right.
And in those cases, then definitely you just go ahead.
Right.
We take the risk. But we mitigate the risk by putting on appropriate attire.
And so, just our final question. So, what might have been done to allow for continuity of surgical care if it seems like what might have to be done if COVID-19 is going to be around for a long time? How would we have to change the way we do things?
Well, certainly our encounters have to change.
Yeah.
We have adjusted to some virtual encounters in order to get the consultation. Testing is a must. We can't get out of this without testing. And I think eventually a vaccine, when it comes on board, patients would have to be vaccinated. And this is the only way that we're going to get out of this, the risk and the problems that we'll have with this pandemic.
Dr. Francis, thank you for joining us this morning, man. We salute you all on the front line.
Thank you.
Taking the risk for all of us. And we look forward to speaking to you again.
All right.
Thank you for joining us at Bahamas at Sunrise.
All right.
We'll be right back after this.
As disruptive technologies go, nothing has shaken up the economy more than the smartphones. Apps have completely changed the way we book taxi rides, accommodation, and food delivery. Business sectors that previously had no digital footprint are now synonymous with technology. While names like Uber, Lyft, Airbnb, Just Eat, and Deliveroo are household names around the world, on-demand business touches many other areas of life. Enterprises are trying to find ways to engage users to their services. Businesses will be forced to connect with their customers with a personalized effect. The complex user behavior needs to be tackled with enhanced conversation and better engagement. Though each of the on-demand business is different, there are elements of commonality which forms the basis of technology stack. Business and entrepreneurs just need to focus on their business operations, not technology. JungleWorks is providing complete tech stack on subscription model to help businesses grow.
One thing, two things, blue thing, all things, things that are small, things that are grand, things that fit just right in the palm of your hand. Fox Hill Nursery, a large selection of garden supplies. If you can see it in your mind, you can find it at Fox Hill Nursery.
Welcome back. Wonderful interview, Mark, with Dr. Francis. Important information we need to know. And I want to remind each and every one of you, if you have not shared our Bahamas at Sunrise live stream, I invite you to share it right now so everyone all over the world can watch and learn about what's happening this morning. Now, the same day COVID-19 PCR test is now available at Doctors Hospital, and guess what? Results can be available in as little as 4 hours. Here's that story.
On Monday, July 6, Doctors Hospital began offering same-day COVID-19 PCR testing via the Allplex 2019 nCoV assay, developed by Seegene Incorporated, a global leader in molecular diagnostics.
Within a couple of weeks of the COVID virus being emerging in the international scene, we had a test available, but Seegene has been around for over 20 years. And we've been making assays for all sorts of different infectious diseases for over 20 years now. Internationally, it's used all around the world. It has a very strong presence in Canada, in Europe, Asia, and now in the Caribbean, so it's been widely accepted.
This system offers a streamlined workflow with quick steps for detection of COVID-19.
We start by taking a nasopharyngeal swab. You put that swab into a collection device, and then that collection device, the liquid in that collection device has the sample, and then that collection device is loaded onto the system, and then the robotic liquid handler processes all the pipetting steps to mix all of the reagents to extract the DNA from the sample, mix them with our proprietary chemistry reagents, and then it gets put onto an analyzer to detect all the gene targets for COVID.
With results available in as little as 4 hours, the new system significantly reduces the 72-hour wait time, now 10 to 14 days when available.
One of the biggest advantages that Seegene has is our ability to have high-performance, highly multiplexed assays, meaning that we can detect multiple targets in a single reaction. And we're able to do this in a high volume setting, so we can not only just do one sample at a time, but we can do runs of, say, 100 samples at a time. And we're one of the only tests to provide all 3 gene targets for the COVID assay.
The current capacity of the Nimbus is 300 to 500 per day. The add-on machine in about 6 weeks or 2 months ramps that up to an additional 1,000 per day.
So basically we get same-day results. The process takes about 5 hours to process up to 96 samples per run. And then after that, we can have about 96 samples coming off every 2 hours.
The ability of this machine to process and produce same-day results has the potential to significantly impact the economy with its ability to quickly provide assurances about the COVID status of arriving travelers when they are held in short-stay quarantine.
You know, the economic benefit is not so much the ability to afford the test, but the ability to provide reassurance. At the beginning of the pandemic, towards the end of March, early April, we realized that we did not have the capacity to test PCR testing. And you may or may not recall, we got into that contentious space about rapid testing. So we knew that in order for us to determine whether a client or a patient is infected, it was really important for us to go straight to PCR. Unfortunately, once the borders shut down, we were not able to get the PCR machine testing capability and capacity. And so we basically struggled along until the minute the borders opened, these guys, first thing smoking out of Canada, they were here with the machine, and now it is important for our patients and the Bahamian public to know that Doctors Hospital has the capacity and the capability to answer the question, am I infectious with COVID-19 now?
There's technology now that's available to any country, and you no longer have to send to another country to do the processing. All these tests can be done by Bahamians in the Bahamas, and that's really going to affect the accessibility of testing, the rate at which people can access tests, and even to help with things like tourism and opening up borders to screen high volumes of people in a relatively quick amount of time.
So we will focus on making it affordable, because we know that the real economic implication is the assurance of safety, the assurance that you are not and your employees are not infected.
Doctors Hospital remarked on the additional benefits of the machine regarding the analysis of other virus specimens, as well as its international certifications.
What's amazing about this Nimbus capacity is that it does not restrict us to COVID-19 PCR-based testing.
So the Nimbus is a polymerase chain reaction instrument that brings to Doctors Hospital the gold standard testing. And when we say gold standard testing, we can confirm any test that we used to do screenings on. We're now confirming it here at Doctors Hospital. So the new test menu is not only going to be COVID, it can be respiratory viral or gastrointestinal. So we have several different things to put on the Nimbus, and of course we're expecting to expand shortly.
There are few, if indeed zero, reasons now to have to send specimens abroad, dealing with a 48-hour to 72-hour turnaround as opposed to a one-day test result capacity now available.
Allplex 2019 nCoV assay is validated by the reference lab and is certified for use in Canada and FDA approved in the USA.
Welcome to Doctors Hospital. As the Bahamas reopens, we at Doctors Hospital have been hard at work preparing for the new normal. The health and safety of our patients, associates, and others entering the hospital space is ever paramount and shapes the experience as you enter our facilities. All persons entering the hospital will be COVID screened, which includes a temperature check and a few short questions. There's also mandatory hand and shoe washing stations upon entry. Masks are required and can be provided if necessary. To further limit contact, Doctors Hospital has launched a concierge service that allows for pre-registration, a hospital itinerary, in-car waiting, and a navigator to guide you through your visit. Our pharmacy is now offering curbside pickup and delivery services for prescriptions as well. Social distancing markers are placed around the facility, and scheduling for imaging, including CAT scans, mammograms, and 3T MRIs. Laboratory, including our new same-day COVID-19 PCR testing, rehabilitation, and other services, has also been adjusted. Doctors Hospital is here to serve you with the same quality and care that you've come to expect, even as we enter a new normal. Now, more than ever, Doctors Hospital continues to be trusted and best care now. Isn't your health worth it?
Welcome back. Welcome back to Bahamas at Sunrise. We're at the mid-show, and we had a great show for the first half of the day.
Yeah, and it's so amazing. Doctors Hospital, you can get COVID testing and get your results back in 4 hours.
Oh, wow.
People want to know, they need to know.
Whoa.
And you just came back from COVID-free, Andrew, so.
Yes, I did. So I am good. And if anything, Andrew says, cleanse me.
Tell them you caught the biggest crab in the world you ever saw.
The biggest crab in the world I ever saw. Seriously.
How you, I just saw something on Facebook the other day when I caught a crab, right? And you have to hold it in the back and you have to get it like right behind those pinches, those claws.
Yeah, it's just like catching children. You gotta step on them and grab them behind the ears.
What we gonna do with you? What we gonna do with you? On a serious note though, we are seeing so many things unfold in terms of civil rights and whatnot. And I think about the Progressive National Baptist Convention. They're having their virtual annual session August 4th through 6th, but Congressman John Lewis, I was there last year in Atlanta when he received the MLK Freedom Award from that organization. And it was just such a glorious procession to see them go across the Edmund Pettus Bridge where he marched like 55 years ago, which was known as Bloody Sunday. And, you know, and to have the highest honor to be in state capitol, his body there, all the flags, and he's only the second black, I guess, politician or person in power to be there in the U.S. Capitol, and the one before that was Elijah Cummings.
There you go. Two powerful giant
I'm
in the
serious.
community.
When you talk about the Voting Rights Act, the Civil Rights Act, and all of those things, and this is voting time in the U.S. They already starting to talk politics over here. You see them talking about election.
It buzzing. We ready.
What do you think about these third parties and stuff now? Do you think we have a chance? Are they a viable option now, or are we still stuck on this two-party system?
I think we live in a democratic society, and that we all should have a choice, and that should not be limited to 2, nor 3, nor 4, nor 5. As much as we need to represent the people, then let's bring them forward.
Do you have political aspirations?
I do not.
I'm not sure if I believe that. If I feel that, what we got going on in the second half, because you're speaking with some interesting people, and I got DeLon Brennan.
Yes, and so you'll be talking to DeLon Brennan. I'm going to be talking with BPL about some of the best news I've heard all year. 2020 been a year, but hey, BPL rates are decreasing. It's Christmas time.
Well, that's amazing. But, so you can talk to them about all the stuff trending about them on social media, right?
Yes.
Because electricity was off this weekend for a lot of people.
Yes, hold on. I have to say happy birthday to Judith Maycock. She is 65. Happy birthday and enjoy your day. Enjoy another lap around the sun.
And happy birthday to Toby. So many people are celebrating birthdays. This is exciting. This is an exciting. Godfrey Burnside is laughing because he still recalls. You missed it. One time it was storming so bad outside. He must be went outside the Met office and a man was there and say he saw a man riding the lightning bolts.
Yeah, old man. He come down on the lightning bolt. They have a whole song about it, right? So Godfrey come down on the lightning bolt.
Oh, you think that's where that song came from?
So let's hear from the man that came down on the lightning bolt. Brother Burnside.
Weather at Sunrise, brought to you by Bahamas First. First in insurance, today, tomorrow.
Thank you, Mark, and good morning, Mohammed. Just a second look at the weather at sunrise, the tropics, and we do have tropical depression Hannah on northeastern Mexico. That should fizzle out sometime later today. But our eyes, and for the Bahamas also, is on a broad area of low pressure that's becoming better organized over the central Atlantic, about midway between the coast of Africa and the Lesser Antilles. The system is moving west to west-northwest at 15 miles per hour. This system has an 80% chance of development over the next 48 hours. A tropical depression or tropical storm is likely to form within the next day or two. Elsewhere, tropical storm formation not expected during the next 5 days. On the local scene, high pressure is the dominant feature across the islands, and we do have some Sahara dust moving across, and that will suppress most activity over the next several days. In your marine forecast, winds today through Wednesday will be east to southeast at 10 to 15 knots, sea 2 to 4 through the northwest Bahamas, those winds falling light and variable at times. But we do have a caution over the central and southeastern islands, those winds easterly at 15-20 knots, seas 4 to 6 feet. Yeah, tides. You can expect a low tide at 7:55 this morning. Next high tide will be 2:17 this afternoon. Low again tonight at 8:38. Sunset 5:58 this evening. Rises tomorrow at 6:36. UV index 9. Your water temperature 82 degrees Fahrenheit. And your moon phase for its quarter. External look that high pressure will dominate over the next couple of days, and so we can see sunny skies, hot temperatures, humid at times, and there's a chance a couple of showers or maybe a possible thunderstorm by afternoon. Those temperatures daytime will be in the lower 90s, at nighttime in the upper 70s. But we must watch that area of low pressure in the central Atlantic moving towards the west, because our projection seems that will take it towards the Bahamas over the next 7 to 10 days. That puts her up on your first, a final look at weather at sunrise. I'm Godfrey Burnside. Back to you, Mark.
Thank you, Godfrey. On July 9th, BPL executed the first ever fuel hedge transaction in the company's history, which will project a savings of 30% for the average customer through January 2022. Wow, right? Here to tell us more about that and other things happening at the company is Dr. Donovan Moxey, Chairman at Bahamas Power and Light. welcome to Bahamas at Sunrise.
Good to be here.
Or
Good
should I say
morning.
welcome back? Have you been on the show
Yeah,
before?
I've been on the show many times.
See, there you go.
And I'd like to say good morning, Bahamas, too.
Yes,
as well.
good morning. I should just give you this.
No, no, it's okay.
So, good morning. And this is an exciting topic.
Yes.
I think 2020, look at that, I'm already in 2022. 2020 has been a year where things have not gone as planned. And it's always positive to hear something new, to hear BPL is doing wonderful things for the country that's going to benefit everyone. So tell us, what is fuel hedging and why has BPL started to do it?
Excellent. No, great. So what I want to do is just start first. When we got started as a board back in 2018, we were given a mandate and directive by the government to go ahead and actually build a utility where you have stable power at the lowest possible cost and improve customer service. And so what we did was we went about structuring a strategic plan around this. And one of the plans that we had for cost stabilization was indeed fuel hedging. Now, what is fuel hedging? Fuel hedging is essentially a financial instrument or technique where what you are able to do is purchase oil at a certain price that's guaranteed for the future. And so hence you're hedging against the market, if you will, as well. And there are many different other techniques you can utilize for that.
That sounds like a great strategy. How does that save the customer money?
Excellent, good. So as we all know with COVID-19, and even prior to that, price on the oil market has always been up and down and very volatile. Yeah. And with COVID-19, there was a serious dip in oil prices. Obviously, markets got affected significantly, and we didn't know how our customer base was going to respond. Right. So what we ended up doing is we said, listen, we need to really take a look at this and see if we can execute the hedge. Because as people would know, we've been talking about this now for a while. Right. And so we plan to execute a hedge this spring, even if COVID didn't happen. Right. And so we looked and we analyzed the market, and we determined that now is the best time, given how our customers responded very positively to us when we asked them to come in and pay, given what our projections were in terms of use of electricity, that this was a great time to hedge. And when we hedged, we were able to lock fuel prices in such that pass through to our customers was really around 10.5 cents. So customers will see something between 10.2 and 10.5 for the next 18 months.
Instead of, what was it, 19 for the most part?
It swung widely. It was 19. It was even as 27 cents a few years ago. Wow. And so there's huge swing in that. And so what we're now able to do is stabilize that price for our consumers. Okay. And when you look at it, our rates, which the regulators allow us to charge, as well as our fuel pricing now is stable and set. Yeah. So the only people who can really control your costs now is the consumers through consumption.
That sounds like something for consumers to be really excited about.
Yes.
What's the future of fuel hedging?
For us, we see this as being one of those tools in BPL's toolbox forever. Yeah. And so here we were able to initiate it here for the very first time in 2020, and we see this as being something that the company will always leverage moving forward.
So hedging is an innovative strategy that you mentioned came from your strategic plan. What other innovations can you talk about at BPL that's going to be rolling out or that you've already been working on?
Definitely. So when we started the strategic plan, again, when we looked at what we were trying to do to really turn the company around, it was really solidifying generation. It was obviously improving transmission and distribution, and obviously our customer service. So here's what we've done. We just essentially launched the largest power plant ever built in the history of the company back in December. That's a 132 megawatt power plant at Station A. So given that, our generation essentially is stabilized, and everyone can see that our generation has improved over last summer. The other thing that we've done, we've launched our call center. We've actually expanded our call center hours. And so now, rather than our offices closing at 4:30 p.m. in the evenings, it now closes to 7. So we have extended that, and we're looking to actually improve those services as well. When you look at what we're doing with respect to transmission and distribution, we used to have significant issues and outages in the West. And so what we've done is we've added a new transformer to our Windsor field, and we're constantly improving in our transmission and distribution system. Now, it's not there where we'd like it to be yet, because I think many viewers will note that we have pockets of outages. And this is primarily due to transmission and distribution issues. We recognize those are issues, and we're working to fix those issues.
So what are some of the other elements of BPL's strategic plan that are in the early stages?
Excellent. So our strategic plan is made up of 5 key components. The first is safety, because we want to make sure that we maintain a safe operation for our employees as well as our customers. The second is our people, investing in our people. And one of the things we've been doing over the last year and a half is really improving our training programs. And those will continue to be improved over time. And so we know that if we build people that have very strong competencies, then they're going to deliver good quality service. And the next is really our asset management, if you will, as well. And so when you look at what we're doing in terms of our assets, when you look at what we've done with the generation assets, the T&D assets, we're really improving on that. Then when you look at it, it's really now our customer service. So we've improved on that as well. And then financial management. Financial management really ties in what we're doing now with the rate reduction bond. And so that's the last key cog in what we're trying to do in terms of really rounding out the company.
Tell us a little more about the rate reduction bond, if you may.
Great, yeah. So we've been working on this rate reduction bond now for over a year. We engaged Citi to be our lead book runner for this. Our intention was to come to market this spring, but COVID-19 obviously shifted that entire strategy. But where we are, we're continuing to work in earnest with that bond. We're looking for windows of opportunity in the market so that we can offer that bond to both local and international investors.
That's awesome. And in your I guess in your list of what BPL has been doing, let's say over the past year or two, in that is the renewable energy grid of Ragged Island.
Yes, exactly.
And so tell us a little bit about that and how that will impact renewable energy systems in the country going forward.
Yes, excellent. So everybody know that Ragged Island was devastated by Hurricane Irma. Full disclosure, I'm actually a descendant of Ragged Island.
Oh, there you go.
The house I grew up in was actually destroyed by the storm. But in any event, the Prime Minister made a commitment that we would make Ragged Island a green island, and that's what we've done. We've built the first ever base load microgrid in any island in the country. In Ragged Island. That particular project was delayed somewhat by Dorian because one of our main contractors was out of Grand Bahama, then it's been further delayed by COVID. And so what we're looking at is completing that entire installation here by the end of this year or before, so that Ragged Island will be the very first green island that's generated power based on renewable energy. And then we're also utilizing Ragged Island as a laboratory for other islands in the Bahamas. We have 4 RFPs that are out for renewable grids in Eleuthera, in Andros, in Inagua. And so we're looking to bring those on to stream here fairly shortly. And we're also doing various microgrid projects in Abaco as well as in Providence.
That's very encouraging because especially in these days and times with the uncertainty, one of the words you keep hearing is resilience and sustainability. And people look to renewable energy sources as a way to increase the resilience of our power generation and our security. So I'm glad to hear that Ragged Island is going to be the template and show the rest of the Bahamian Islands how it's done.
That's correct. That's correct.
And so just before we wrap up, just in terms of what's coming up for the rest of summer, so we shouldn't expect to see a hike in, let's say, our fuel prices for a while. We're not looking for 25 cents per kilowatt hour. We're not going to see that for a while, right?
No, that's correct. And so what people will see starting with their July bills, their fuel pass-through will be at around 10.1, 10.2 cents. And you'll see this about 10.2 to 10.5 cents. And a lot of things that go into that slight fluctuation, but for the most part, that's going to be steady for the next 18 months and beyond, because hedging will be a part of BPL strategy moving forward.
Brother Moxie, you've brought some of the best news I've heard all year. And I thank you for coming back on Bahamas at Sunrise and telling us what BPL is doing for the country and for the future.
Thank you very much, and I'd like to thank the Bahamian people for giving us the opportunity to help shape and turn around our utility in this country.
Thank you, man. You keep doing good work. I appreciate it. Thank you. Thank you for joining us on Bahamas at Sunrise. We'll be right back.
As disruptive technologies go, nothing has shaken up the economy more than the smartphones. Apps have completely changed the way we book taxi rides, accommodation, and food delivery. Business sectors that previously had no digital footprint are now synonymous with technology. While names like Uber, Lyft, Airbnb, Just Eat, and Deliveroo are household names around the world, on-demand business touches many other areas of life. Enterprises are trying to find ways to engage users to their services. Businesses will be forced to connect with their customers with a personalized effect. The complex user behavior needs to be tackled with enhanced conversation and better engagement. Though each of the on-demand business is different, there are elements of commonality which forms the basis of technology stack. Business and entrepreneurs just need to focus on their business operations, not technology. JungleWorks is providing complete tech stack on subscription model to help businesses grow.
Business in the Box is your solution for business from Cable Bahamas. It's an internet, voice, mobile, and advertising solution all in one place. Get reliable internet, free domestic call, and a live corporate package, and free TV ad placement, all starting with packages as low as $164 a month. You can save over $3,000 a year. Just call 601-8911. That's 601-8911. And ask for Business in a Box from Cable Bahamas Business Solution. Terms and conditions apply.
Welcome back. Unfortunately, we've seen a sharp rise in the number of COVID-19 cases since our borders were opened. NASA is on weekend lockdowns and Grand Bahama is on a 2-week lockdown. Here to give us an update and shed some light on the circumstances is our favorite health professional, Dr. DeLon Brennan, Deputy Chief Medical Officer, PMH. How are you?
I'm great, ma'am, and you?
Welcome back to Bahamas at Sunrise. I'm ma'am.
Yes, you're a ma'am now.
I'm doing pretty well. It's good that we could have a little chuckle in light of all of these serious things happening. I want to ask you,
sure,
what is your schedule like? Because you always look so fresh and so energized. How many hours do you put in a day?
Unfortunately, now that a pandemic is going on, none of us expect anything like this. This is all day, every day. So it's a 7-day a week, 12, 14 hours a day. It is constant.
Wow. Yeah. And so, but what is, I guess, the newest revelation or thing that has shifted since the pandemic?
I think one of the things that we realize is you realize how some things are absolutely essential,
right,
and other things really become so secondary that you could leave them alone, where you really thought that they were so important before, but when life boils down to you really need to get a few things done, you realize what are the most important things. And unfortunately, having to force people into their homes and to stay with family and to do things with, those who are closest to you and just shut everything else out, that's what it's taken to get people to go back to the essentials. And I think that's really important for us. So it's, what are the essentials in medicines? What are the things that you absolutely need to have? Who are the people that are important to delivering care? What are the structures? What's the equipment? That kind of stuff is really brought to the fore, and you leave a lot of the frills and the esoteric stuff to the side.
Yeah, it is very important, and I think people are starting to realize what really matters most. So what is the current number of active cases in the Bahamas and then the Family Islands? I see we just got one in Exuma. What does that mean for them?
So what it lets us know is none of us are immune. I think in the first instance when we were having cases, we had 104 cases, and even adding in that 104, which are not all, none of those are active at present, but we're now up to 362 cases, if I remember correctly.
I thought I just saw 342.
Right, so we're up in the 360s. So you're now adding a whole nother 260-ish cases to our number, and what happens is all of those are now new active cases because they've only started to occur since about July 8th. And so now that we're continuing with those, this fast accumulation of cases in this past 3 weeks, that has become a bit of a concern for us, because what it also means is it isn't just something that is relegated to 3 islands or 3 islands in a key, because last time it was in Providence, Grand Bahama, Bimini, and Cat Key.
Right.
Now, unfortunately, you have multiple other islands involved. So you mentioned Exuma. There are things that are happening in Cat Island. We have concerns about San Salvador. It's likely that all of our islands are going to be affected.
But can we contain it in Exuma? Because if one person has it, then that probably means that a lot more people are going to be. How do we contain it and just?
I think the containment exercise is the same everywhere. And so this is what we have to take seriously. What we did was kind of a model for how the world could go about doing it when we first got cases. So within our first, less than 10 cases, we basically said, we are going to minimize people's ability to pass it on from one person to the other. So if you didn't believe that's what worked before, you see the evidence of that now, because once you see, 1, 2, 10 cases, we basically said, shut it down. We stopped travel. We stopped people being able to mingle. Restaurants closed down. Churches closed down. Weddings, funerals, everything was brought to a halt.
Yeah.
And we were able to. It took us, a couple of months to do so, but we were able to keep our curve fairly flat, and the highest number of cases we had in one day at that time was April 1st, where we only had 6 cases.
Exactly.
But we were able to keep it fairly flat until mid-June, where we were at 104 and really rolling steady for a few weeks.
But it's that balancing act, right? So we want to open up the economy, but then we still want to stay safe. I know so many of us are washing our hands and wearing masks, but what are we not doing right?
I think the thing is, that there are some of us who are doing those things, but there are many people who are not. So when we first saw the rise that was happening in Grand Bahama, I had an opportunity to actually go to Grand Bahama with a team of health professionals, physicians, nurses, microbiologists, to really address what their needs were. And as simple as just going out to get food, right? You want to go somewhere, pick up food, and take it back. I had to skip 4 different places because people were there. They were congregating in large groups. No one was wearing a mask. It was one of those things where even though we say we're doing those things, we're not doing it. And that's what is happening around the country.
I want to ask you about the evolution of this virus, because we're hearing like, oh, it lasts on surfaces, then now maybe you can find it in animals or younger people now. What's happening?
I think, we just discovered this at the end of 2019, so beginning of 2020. So we have just about 6 months worth of real knowledge as it comes to this. And, we're still discovering new things about influenza, measles, and the like, and we've known about those for 50 years. So 6 months, you're still trying to find out how long does it last on surfaces? Can it be passed from animals to humans or from humans to animals and the like? So that's a lot that you're still learning. But the core of what happens is still the core of any, respiratory droplet past infection. And it really, if we could contain and do what we need to do for those issues, we would be fine. And so while the greatest and latest of science is great to know and we want to discover, we need to do those basics and really, the same things that apply. Cover your mouth, so that you don't pass your respiratory droplets on to other people. Wash your hands. And we know the wording around it is new, but staying away from people who are sick is really what it is. So social distance is just that. Stay a good distance away from people who have the potential to pass it on to.
There's so much more that I want to ask you, so this has to be our lightning round, okay?
Sure.
There are some promising drug treatments in the UK. Where are we at with the vaccine?
I think the vaccine, there are about 100 companies around the world who are developing vaccines right now. So there are some that have actually moved on to clinical trials. And so it's looking promising. But the hope of a vaccine is really likely early 2021 at best. And even when you get it to early 2021, you're talking about it being introduced in populations where you only have, lots of money, lots of people, and high burden of disease. We hope not to be one of those countries, because if you are doing that, you're really suffering in your healthcare system and the whole like. If we could control this using public health measures, we'd be able to do so without even the need for a vaccine. But we sure are hopeful that a vaccine will come along pretty soon.
Okay, the Honorable Minister Jeff Lloyd suspended examinations, 100% remote learning until October. What goes into determining when kids will be able to go back to school?
The big thing is going to be the rise in number of cases that we're having and our ability to control it. So as long as when you watch the epidemiology that happens in country, the slow first wave that we had and this ridiculous amount of acceleration we've had the second time, if we continue on a trend like that and we still have numbers where you're having 50 cases in a day, there's no way we can say that we could safely move about the country and do those kinds of things, because you never know what the real burden is, because people are moving about and doing things, and not everyone's even going to come in for testing. You could offer as much testing as you want. Not everyone's going to come in. Testing is only good for that one day. So if they test negative today, are you going to say it's okay for them to just go out into society? Testing is not a panacea. There's no euphoria to it, because we know that it doesn't give you the full picture of what's going on in society.
Do we have all the tests we need? Yes or
we
no?
do. I think we have, at last count, we have approximately 15,000 tests that are available right now, and we're doing, if you watch the numbers, we're getting more and more testing done, both in the public sector and also at our private sector partners as well. So our numbers are growing. But with growth in tests, you get growth in numbers, but people aren't reacting to those growth in numbers with changes in their behavior, and that's what's necessary.
You have to come back, because there's much to talk about, and I want to talk about that process where people have to self-quarantine and all that tracker and stuff. That is hot news. You got to come back every time we have Bahamas at Sunrise. Thank you so much, Dr. DeLon Brennan. Always a pleasure having you on Bahamas at Sunrise. We'll be back after this.
One thing, two things. Blue thing, all things. Things that are small, things that are grand, things that fit just right, and in the palm of your hand. Fox Hill Nursery, a large selection of garden supplies. If you can see it in your mind, you can find it at Fox Hill Nursery.
So we had such a great show today, right? Such wonderful guests. What's it today? It's Monday. It's Monday. Gandhi and I are here saying good evening, or good morning, right?
Good evening.
Good evening. Good morning. Right? Star and Phil, I hope you guys are enjoying yourselves. You're sleeping in this morning. We had such a great show today, right?
Yeah. Lots of important information. So much to do. And just speaking with the health professionals, let me just move on over here. Yeah. Good show. And we're just wishing everyone a wonderful and productive week. We know that sometimes Mondays can kind of like
be hard.
Shelly and Chris Tucker at the same time are like, Candy, look at this camera. But I don't see me.
You're gonna come on. But hey, guess what? The holiday weekend is coming up. You think we can be able to go to the beach this holiday, or this and that?
In the words of our illustrious dear colleague, don't do it.
Well, enjoy the rest of your day. It's been a great Monday.